rosacea.
Brooke, what brings you here today?
Well, I had this rash on my face, and it won't go away, and it's sort of red. I thought it was acne, but I don't know. What do you
Brooke,
think?
it's rosacea. Rosacea is a condition that causes redness and often small, red, pus-filled bumps on the face.
That's exactly what I have.
Dr. Grace's facts.
Skin has 3 layers. The epidermis, which is the outermost layer of the skin, which provides a waterproof barrier and creates our skin tone. Then there's the dermis, which is beneath the epidermis. It contains tough connective tissue, hair follicles, and sweat glands. Then there's the hypodermis. Skin has 3 main functions. 1 is protection, 2 is regulation, and 3 is sensation. Cells of the epidermis. There's stem cells, which is the deepest layer. There's keratinocytes, which synthesizes keratin. Then there's melanocytes, which synthesizes pigment melanin that shields DNA from ultraviolet rays. Then there's the tactile, or the Merkel cells. Then there's the dendritic cells. Layers of the epidermis. Stratum basale. Stratum basale is keratinocytes resting on the basement membrane. Stratum spinosum is more and more keratin filaments, which causes cells to flatten. Stratum granulosum has 3 to 5 layers of keratinocytes. Then there's stratum lucidum, which is only in thick skin. Then there's stratum corneum, which is resistant to abrasion, penetration, and water. Parts of the neck, chest, scalp, ears, and back may be affected. Many experience dry, flaky skin, while others have normal or oily skin, or some who have both experience rosacea. So, Brooke, how do you feel?
I'm okay. I'm just a little confused why I have it, though.
Well, symptoms of rosacea are most commonly affects a middle-aged woman. You're not middle-aged, so that's kind of weird. It also can be mistaken for acne. Facial redness with swollen red bumps and small visible blood vessels are often seen. Redness may resemble a blush or a sunburn.
Well, how does it affect my body?
Well, it's complicated. In severe and rare cases, the oil glands in your nose, sometimes your cheeks, become enlarged, resulting in a buildup of tissue. The buildup of tissue on and around your nose is called lymphoma.
Well, are there any tests that you can do?
Well, for tests, there's no specific tests or procedures are used for diagnosing rosacea. Instead, I will most likely make a diagnostic based on your symptoms.
Is there a cure?
There is no cure for rosacea. Although there is no cure, there are antibiotics in the forms of creams, gels, or lotion. If creams don't work, try acne medications that also help. Worst cases, you might want to think about surgery. As we talked about before, lymphoma can be treated with laser surgery and electrosurgery to reduce the visibility of blood vessels. If you have fair skin, you are more likely to get rosacea. Celtic or Scandinavian ancestry usually have rosacea. People with rosacea often have a mite on their nose and cheeks. Your immune system reacts badly to bacteria, causing rosacea. Brooke took the path to use creams and lotions to reduce her symptoms. You can live a happy life with rosacea.